Okay, so let's talk about embryonic and fetal testing, which have become very common procedures these days in most pregnancies. Most moms will have some kind of testing at some point during their pregnancy. So the most common test would be an ultrasound. Now, of course, for parents, a lot of times we're just excited to see the heartbeat and we want to see maybe what if we can tell what the sex of the baby is going to be, things like that. But there are medical reasons for an ultrasound, to make sure that the placenta is not too close to the opening of the cervix. That would be something that doctors would need to know before delivery. They look for any kind of physical abnormalities like spina bifida or any kind of, abnormally small size or anything that would be out of the ordinary. They look for that during an ultrasound. Most moms get to have the joy of going through an ultrasound and looking at the fingers and seeing the nose in profile and thoughts like that. But there are medical reasons why ultrasounds are usually performed. Sometimes for some doctors, they'll do the ultrasound, what they think is probably 7 weeks after conception to make sure that the pregnancy is implanted in the uterus. And then a lot of times they'll do it again somewhere around 24 weeks-ish. That's usually the time when you're going to be able to tell the sex of the baby, but it's also a time when the doctor can, try, double check the date of, what they think is probably going to be the birth date. And they can look for other kinds of physical abnormalities. Sometimes they can fix the physical abnormalities while they're still in the womb. They've got, surgeries that can be performed in the womb these days. Sometimes it just helps them to prepare, the parents for things that might be coming, and it also can be a way to prepare for what might come up during the birth. So usually between the 9th and the 12th week, and then a lot of times again, 24 weeks. Chorionic villus sampling is a DNA test that can be conducted about 8 to 10 weeks after conception. And in this procedure, you use an ultrasound to locate the placenta, and then a thin tube is inserted through the opening of the cervix, and they suck some of the baby's cells out of the placenta. The chorionic villus is chorionic villi are the little fingers that are embedded into mom's uterus, and so they collect some of the baby's DNA. And usually this test is reserved for situations where you've got a mom who's of advanced age and they're concerned about chromosomal abnormalities, or they might be concerned because mom and dad come from a population that has chromosomal illnesses that go along with being from that population. They might be looking for Tay-Sachs or different kinds of DNA related disorders. And between 8th and 10th week, this is early first trimester stuff, and so there's if DNA issues are found, it's an opportunity for mom and dad to still make a decision if they want to carry the pregnancy to term or not. Whereas with an amniocentesis, it can't be conducted until the 24th week. So we're talking about a fetus that if the parents have made the decision that they don't want to keep a developing fetus that has certain kinds of chromosomal problems, this is a much bigger termination and a much harder choice. So amniocentesis is, it used to be the gold standard. It was the only way, and then they invented the chorionic villus sampling. But amniocentesis, sometimes if you have a chorionic villus sample that tells you that you have a chromosomal abnormality, they'll follow up later with an amniocentesis to double check, that you don't want to be making the wrong decision. Now you'll notice with the amniocentesis, it's a little more invasive. There's a very long needle that's inserted through mom's abdomen. And again, they use ultrasound to locate where the baby is so they don't actually pierce the baby. And then they suck some of the amniotic fluid out, and then they can check the baby's DNA from that fluid. So 2 of those tests are tests that might lead couples to be thinking about termination. And then, of course, abortion's available for other reasons also. So I thought this might be a appropriate time to insert a discussion of abortion. most of us, when we think of abortion, we think about surgical abortions, where you would go to the doctor and there's either a vacuum aspiration is performed or a dilation and evacuation is performed, oftentimes referred to as a D&E. So it's a procedure that's pretty intrusive, and it can be used pretty much anytime during a pregnancy. Roe v. Wade, which is the law that governs abortion federally, there are limitations to how old the fetus can be and still be eligible for an abortion. It's kind of vague because the Supreme Court declared it was the point of viability, which in American hospitals, the ability of a baby to be viable, to be able to survive, has gotten younger and younger. So we're looking at 24 weeks. Some babies have survived at 20. So it's kind of a little rough guess of where exactly the line is. But for most doctors who are doing elective abortions, it's going to be towards the first trimester. Rarely are elective abortions performed after 12 weeks. Generally, the ones that happen after 12 weeks are more likely to be because of chromosomal abnormalities or because of the health of the mom is in danger. If an abortion is being performed in the first trimester, the mom is eligible for a medical abortion, so it's less invasive. There's medication that you can take, either Mifeprex or RU486, and it's a prescription. So you have to go to your doctor to start the procedure, but it's pills instead of surgery. So instead of an invasive procedure, it's a kind of like the morning after, but very much more intense. The morning after pill or Plan B, but much more intense, because now we know that you're pregnant and we're trying to get it to basically miscarry. So we have, a uterine lining with a fertilized egg embedded in it, and so the body's secreting a bunch of progesterone to help maintain that pregnancy. And so what Mifeprex does, at least the first pills, work by blocking the receptors for progesterone so that they will stop responding and then actually trigger the onset of basically a period. So the first thing is that you get 600 milligrams of this mifepristone medication, and it blocks progesterone. And as a function of blocking progesterone, the cervix starts to soften, it dilates, the endometrial layer thins and starts to shed. You start to have a period, basically. 2 days later, you take a 400 milligram dose of misoprostol, which encourages uterine contractions so that the contents of the uterus get expelled. 2 weeks later, you go back to check with the doctor to make sure that there was a complete abortion, and if not, then you have to follow up with either a surgical abortion or a decision to keep the baby. So, and again, these medications won't harm the baby. They aren't teratogenic to babies. They just cause the uterus to start functioning as though it got the message to have a period. This medication is approved for use up to 48 days after 49 days after conception. So that's 7 weeks. And within that age range, or that date range, it's about 97% effective. So, the closer you're getting to 49 days, the less effective it's likely to be. But about 97% of the time, these medications will successfully expel the little embryo. Okay. I wanted to mention on the Mifeprex that it sounds like kind of like Plan B. Plan B can cause pretty good cramping and a pretty heavy bleed. Mifeprex will cause significant cramping and a significant bleed because there's more to expel. It also can cause nausea and other kinds of things. So it's not like an easy process, but it's much less invasive than a surgical abortion. When do women have abortions? 1/3 of abortions occur at 6 weeks of pregnancy or earlier, and 89% occur in the first 12 weeks. So the vast majority of abortions in the U.S. are first trimester abortions, and most of them are performed in the first half of the of the first trimester. So for most women, when they realize they're pregnant, they usually and they don't want to be pregnant, then they and they know that they want to have an abortion, they take steps to follow through with that earlier than later. There's we get distracted by conversations about late-term abortions and things like that, which are very, very rare. Very small percentage of abortions are in that late-term area. Okay, abortions by maternal age. People have a stereotype that abortions are being performed mostly on teenage girls who didn't know how not to become pregnant, and we have like this assumption. I call it a stereotype because we hear the word abortion and then we think immediately of like a stereotypical person who we think is the type of person who would have an abortion. But what this data shows is that the most common age for an abortion is between 20 and 24, and that the next most common is between 25 and 29. So it's among women who probably do know how pregnancy occurs and who have become pregnant when they didn't intend to, and have the ability to take steps to end the pregnancy. So it's and look at the rate between 15 to 19-year-olds versus 30 to 34-year-olds is pretty comparable. So older women are more likely, women who are not teenagers are more likely to have abortions than teenagers are. If we look at this by breaking it down by the three main racial groups that data tends to be collected on, you see the differences in rates by race, and then you see the differences in the rates of unintended pregnancy by race. And you can see that there are, there's like a correlation between the rate of unintended pregnancy and then the rate of abortion. And then you can also see that, for each racial group, there are many more unintended pregnancies than there are abortions. And so that's, roughly half of black women who become unintentionally pregnant will have an abortion. Roughly a third of whites or Hispanics who become pregnant will have an abortion. We have this data that shows across time since 1973 the rates of abortion, and you can see that abortion had been illegal prior to 1973, and so the rates of abortion sort of steadily climbed and stayed pretty reasonably high until about 1991. There was a significant change in sexual behavior starting in the 90s. There's like every chart I show you, you can see that age at first intercourse has gone up. Pregnancy rates have gone down, abortion rates have gone down since the mid-90s. So we see that same thing with abortion rates. All right, so enough about that. Let's get back to stuff that's going on to mom while she's pregnant. So here we have a drawing of basically mom with a 9-week-old fetus. And you can't really see a lot going on outside on mom. She's starting to get a little bit of protuberance on her abdomen from being pregnant, and it's not really attributable to the baby. It's attributable to, thanks to hormones, things are moving around in her abdomen. Her breasts are going to start swelling, things like that in response to the hormones. But here we are 24th week, and now, it's the baby's fault. The baby is sticking out. You'll notice in both these pictures, baby is head up. Up until the end of pregnancy, the baby can be in any position. They roll around, they do all sorts of crazy stuff in there. By the end, the baby will be head down. Now, this is supposed to be the same woman, although she looks a lot more tan on the left than on the right, doesn't she? I guess she stopped going out in her bikini or something. I don't know what's up with that picture, but what you'll notice on the right is that her breasts look larger, and they are starting to get larger. A lot of times the pregnant woman herself doesn't really notice that her breasts have gotten larger because her stomach's getting bigger, and so she doesn't really notice that her breasts are starting to swell, but they are. They start to swell pretty much as soon as she becomes pregnant, and they continue on through the pregnancy. So that here we are by the 40th week, and 40th week she is ready to deliver that baby. There's really no more room for her intestines, her liver, all of her internal organs and that baby. But again, you'll notice bodily changes. Assuming this is supposed to be the same person, her breasts have definitely gotten larger. But like I said, she may not believe that because her stomach's so big. So she's thinking, well, everything else is reasonably close to the same size, and then I just have this gigantic stomach, right? Now, this is kind of a little bit of a I went with the labels that doctors tend to use when talking to moms, because doctors will tell moms that they'll be pregnant for 40 weeks. But if you do the math on how many days gestation the average human endures, you'll realize it's really only about 38 weeks. And the reason for the difference is that doctors ask moms, when was the first day of your last period? Because that's the last thing she knows for sure. And then he counts from the first day of her last period until delivery. That's going to be 40 weeks. But since you've had human sexuality, you know that you don't get pregnant on the first day of your last period. You get pregnant typically 2 weeks later. So in actuality, from conception until delivery, it's 38 weeks. Now, I wanted to mention quickening, and I forgot to do that before I put the 40th week person up there. Quickening is usually going to be noticed sometime after the 12th week of pregnancy. And it's the ability to detect that the baby's moving around inside mom. Usually mom can feel it before anybody else will be able to feel it from the outside. It's like for mom, her first sense of quickening, it feels a little bit like, those muscle twitches that you can randomly get? Maybe your eye twitches sometimes. It's kind of like that, but it's very low in the pelvic region, and you feel like, what was that? There's like some kind of weird movement. I was lucky enough that when I had that sensation for the first time, I was with my mom, and I said, "Man, my stomach just keeps spazzing out." And I gestured down low when I said stomach, so I obviously wasn't talking about my stomach. And she goes, "Does it feel like a butterfly's wings?" And I'm like, "I guess." And she goes, "Yeah, that's the baby." I wouldn't have characterized it as butterfly wings. To me, it felt like a muscle twitch or something. It felt like, a spasm. Not painful, just a little, like it was doing it unbidden. I wasn't doing it. Something was doing it to me. So that's the first kind of sensation mom will tend to experience, and then slowly but surely it becomes way more obvious that there's a baby moving around inside the womb. And in fact, you can Google fetal movement on YouTube, and you'll find videos of moms who have just clearly aliens in their abdomens, baby feet moving around in there and undulating abdomens. And I mean, it's really clear by the end that there is a fully formed baby inside this person's body. It's almost a tiny bit creepy, but also pretty cool. So, all right, well, let's go ahead and take a break before this baby gets born, because we're going to go into labor and delivery next.